it's always a balance between risk and benefit in any treatment in medicine, and MEVO thrombectomy is no exception. And the kind of challenge with medium vessel occlusions is that the occluded vessel is smaller, meaning that the brain damage is also smaller compared to larger vessel occlusions. So patients do generally better, even without kind of any invasive treatment. And the other problem is that invasive treatment is harder in those distal occlusions because they're smaller vessels, tinier and fragile, and it's harder to get to those kind of more peripherally located vessels. So the risk of accidentally perforating a vessel or dissecting a vessel with a wire or a catheter is higher. So the benefits are lower, the risks is higher, and the question is where the tipping point is, so to speak. And that's what we're trying to find out with those trials. And then there are just technical challenges. For instance, catheters are they have a certain length. And the more peripheral you go in the brain, the longer your catheter has to be. And the current catheters, they're mostly designed for large vessel occlusions that are more central. So sometimes you actually run out of catheter length and your catheter is just not long enough. So that problem hopefully will get solved because companies kind of will design longer catheters. But at the time being, we have to kind of deal with those kinds of issues as well. There's the trial that we're running, that's ESCAPE-MeVO, run from within Calgary, but there are sites in Canada, the US, Germany, and Hungary, and the UK. Then there's DISTAL, that's the Swiss trial, which is running in Europe mainly. There is DISCOUNT, which is a French trial. Then there is Frontier AP, I think, that's an Australian trial. Then there's another US trial that has a technical outcome, meaning reperfusion instead of a clinical outcome. And I think that's all for now. I hope I didn't forget any. But I think DISTAL, the Swiss trial, and ESCAPE-MeVO, the Canadian one, are kind of, they have enrolled most patients. So it's DISTAL has enrolled around 350 or so, I think. ESCAPE-MeVO around 330. And then the French trial is kind of the next one. And I think they will all finish within 1 to 2 years from now and hopefully give us some answers.